Well, telemedicine is becoming more and more common, and while it may be something the world is still adjusting to, News 18's Meredith Hackler shows us how rural hospitals are able to better care for patients thanks to its growing popularity.
Ultimately, it could save someone's life.
At Franciscan Health in Crawfordsville, telemedicine is used regularly.
We absolutely utilize it more than ever. We don't have the resources here for certain physicians, certain specialty that requires someone to lay eyes on the patient.
And having the option to consult a specialist isn't something rural communities have always had access to.
Having specialty care in those rural hospitals and having those physicians to be on the ground, to be boots on the ground, or people in the hospital, that's more and more of a challenge as we move forward.
Recruiting specialists to rural hospitals has always been a challenge, which is why telemedicine is vital to rural care facilities.
If we didn't have a neurologist here to see the patient, run down the screen, make sure that they are appropriate to receive TPA, which is a blood clot buster, that could actually save their life if they are having a true stroke.
This machine allows specialists to be able to treat patients in rural areas. They can see everything they need to through these two high-definition cameras. And down here, these ports allow the specialist to be able to monitor the patient's vitals as well.
And having access to specialists in rural areas allows patients to stay closer to home.
That allows many of them to stay within their community as opposed to being transferred to a larger facility a distance away.
Meredith Hackler, News 18.
The